Assessment in Cerebral Palsy, Gross Motor Function Classification System, Expanded and Revised Levels. GMFCS ENR is a 5-level classification system describing gross motor function of children and youth 2 years to 18 years with cerebral palsy. The main focus of the GMFCS ENR is on determining which level best represents the child's or youth's present abilities and limitations in gross motor function. Emphasis is on usual performance in home, school, and community settings rather than what they are known to be able to do at their best. Levels of GMFCS: Level 1 Walks without limitations. Level 2 Walks with limitations. Level 3 Walks using a handheld mobility device. Level 4 Self-mobility with limitations, may use powered mobility. And Level 5 Transported in a manual wheelchair. Distinctions between levels are based on functional abilities, the need for assistive technology, including handheld mobility devices or wheeled mobility, to a much lesser extent, quality of movement. It is therefore important to classify current performance in gross motor function and not to include judgments about the quality of movement or prognosis for improvement. How frequently should a child be classified using the GMFCS ENR levels? A child should first be classified when referred for rehabilitation services to assist with realistic goal setting and appropriate intervention planning. Also during interdisciplinary or special clinic visits or when a child is in an older age band. Since GMFCS ENR levels are quite stable after 2 years of age and children are not likely to change levels even following intervention, this is currently being studied in more depth. GMFCS is useful as it has applications for clinical practice, research, teaching, and administration. In clinical practice, knowledge of child's GMFCS ENR level is very useful for communicating with parents and setting the stage for collaborative goal setting. As a result, the system is extremely useful for intervention planning at the level of impairment and activity. In research, it is useful in sample selection, in sample description, and in stratification. In teaching, it is a very useful tool to introduce the complexities of cerebral palsy relating to extremely wide variations in gross motor abilities of children to the student population and service providers of all disciplines. In administration, it is useful in terms of caseload management and resource allocation in health, recreation, and education settings for children with cerebral palsy.